The intent to cause harm is often not there. I was sat at a conference a few days ago with Chris Turner giving a very good speech about conversations in healthcare and how when we go into a conversation or one-to-one with somebody, you almost go in with a, you did this wrong, this is how it happened, this is how I want this conversation to go. This is particularly in relation to incivility. So fly away, throw away comments, behaviours where the victim, the person on the end, has interpreted it as, you've done this, you've caused me harm and you intended to cause me harm. The problem is the systems that people are working in often means that the intent is not necessarily there for the majority of people. And a lot of people, if they understand how the other person felt through a peer-to-peer sort of feedback service and not a manager or not the individual themselves where it doesn't go quite as well because of the anxiety and the emotion that's in that. Actually, when you have a peer-to-peer conversation to address just how that person is feeling, often they will recognise that behaviour and go, oh, I'm so sorry, I didn't mean to come across that way. I had this, that and the other going on. And the problem is we work within such busy, pressurised systems that when you are constantly trying to deliver some sort of safety to every single person in your service with the staffing models that you have, with the guidance that you've got, with the IT provision, with the types of equipment that you actually do have to hand, where you have the resources available. When you are constantly battling that flight, fight, adrenaline, actually there comes a point where you reach that point of burnout in any sort of healthcare service, and sometimes you just bite back, and sometimes it's in the wrong situation at the wrong time with the wrong person. And almost 70% of all incivility happens when you are short-staffed. So when you are under-resourced, you've got sickness going on, you've got whatever else, you've maybe got too many patients and not enough staff to meet those needs. That's where the majority of incivility happens. And what we need to be starting to think about is that when individuals and professionals are burnt out, they are more likely to have incivility events because they are overwhelmed, they are overstimulated, and they just can't process and think rationally and appropriately. And it's got me thinking over the years about all of the incivility acts that I've had. Typically, and this is just a generalisation here, but in the past, when I was working as a clinical midwife purely, it often was a Band 7 delivery suite member of staff who, can I just point out, fantastic at what they do. They are the first person you want in that room when there is an emergency. But they go through so much stress. They are managing whole units. They are trying to make sure that every woman gets out of that unit safely and as safely as possible. They are one of those first people on every single emergency that happens within a maternity care service, whether that's in theatre, in a room, or at the other end of a corridor down a birth centre or on a ward, for example. They are one of the first people to arrive and to be part of that emergency response. And that trauma does build over time, and particularly when you are asking for things like staff or you're trying to balance the books. Actually, that's incredibly overwhelming, and what support is put in place for those Band 7s who are in those systems. And then as a bit of self-reflection, over this year, I have been more overwhelmed and overstimulated than I ever have been. I have found becoming a Band 7 manager the most difficult job I have ever done, and I have not had the nicest of conversations at points. And I have reflected on that, and that's because those points actually were at the point where I probably needed to go off sick at certain points. But I don't want to go off sick because I know the pressure that that places on everybody else. I also know that if I go off sick, all of that work is just waiting for me when I get back, which is not great in itself because then you're counteracting when you actually do come back. And the other aspect is learning a new role in itself is overwhelming. When you're expected to pick up so much, it's hard. And when I reflect on some of the conversations I've had with individuals over the year, they haven't been the best that they should have been. And on reflection, it gives me the opportunity to go back and think about those things more rationally. And I can only apologise to those midwives where I have done things because there is a deadline, there is a time frame, as opposed to being able to think about it, process it, think about what the date and the time is, what time that these people are coming off shift when we're having those conversations. And that requires not being overwhelmed, not being burnt out and overstimulated, because when you are burnt out and overstimulated, you start to lose your empathy, you start to lose that compassion, because what you need to do is take a breather, take a back step to be able to process what's going on and then step back into that role and give that time exactly to what it is. The problem is this system was not designed to be able to resource it adequately. And when you start removing a resource at a time, whether it's a member of staff for sickness, whether it is that you have got too many people because you are bed blocked as such, you've got that high turnover of people because your populations are increasing and your hospitals and your beds are not increasing and your community provisions are not increasing in line with the population demands. And the job profile of one person is now becoming more and more and more and more. What happens is you end up breaking individuals. Those broken individuals end up having conversations with other individuals and breaking them. And that system and that cycle continues and continues to develop. And we are all imperfect individuals working in imperfect systems. And I'm far from perfect. I just want to add, I have done my best to lead with as much compassion as I can do. But there have been points throughout the year where I probably should have taken a back step, but I felt impossible and unable to do so. And I even went in at times where I was still unwell and still sick. But then when you're battling other sort of HR policies and you know that the pressure it makes on the rest of the system when you go off sick, that's incredibly difficult to take that back step and say, yes, I am burnt out and I do need to take the step back. But actually I know that I'm going to go through a HR process, for example. Alternatively, I am putting that system even under more pressure, because if I go off sick, I can no longer look after those 7 or 8 women. So that means those 7 or 8 women will go on the existing workforce. And so they will be picking up the slack and they will be put under more pressure themselves. And that pressure in itself means that they are more likely to break. And so their system, that downward cycle continues. And yet, if we properly resourced the entire healthcare service in every system, in every ward, we probably wouldn't end up with the sickness rates that occur entirely. Staff would be healthier and happier, they wouldn't be so burnt out. Put in proper trim practitioners in each unit where we can really debrief after every single emergency that happens, so that we can process and have time for people to be able to process those events, particularly when it's a recurrent theme, it's a daily contact for you. It would probably make things far better and safer. But the first step to that is investment in the healthcare service. And until it is properly invested in and properly resourced, it's asking the same system with the same money to continue to do more, because it's always asked to do more with less resource, basically. And we are putting more pressure overall on the system by not even thinking about the basic resource in the first place. Anyway, that's my ramblings for a Friday morning.